In this video, we demonstrate how to measure patient samples with the CYANElite 290. Ten patient samples fit on the sample tray. To indicate which sample is placed in which position, it is necessary to configure the sample list. To do so, navigate to the Samples menu. On the right side, select the Sample tab and fill in the information fields. First, insert the sample reference. Then, choose a specific position on the sample tray. Select the type of tube used. You can choose between a 5 milliliter tube or a 1 milliliter cup. By default, the nature of the sample is serum, but it is possible to change to a urine sample if applicable. In the Type drop-down menu, select if it concerns a male, female or a child sample. This will allow the system to evaluate the result with the pre-programmed normal reference ranges. And finally, press the Urgent button to indicate the sample should be analyzed with priority before any other sample. It is advised to link a patient to the sample to be able to create patient reports. These reports will give an overview of all tests performed for this patient and will allow the doctor to follow up the effectiveness of a medical treatment. To link a patient, press on the arrow of the drop-down menu. If the patient has already been introduced in the system in the past, his or her name will appear in the drop-down menu and you can select it. It is also possible to type the name to perform a search in the existing patient list. If it concerns a new patient, select New. A new window opens. Enter the name and the family name of the patient. And again, select if it concerns a male, female or child patient sample. Press on the New Patient button to save the patient information. Lastly, press the Add button to include the sample in the sample list. Repeat these steps to include more patient samples in the sample list. It is possible to add more than 10 patients to a sample list, although only 10 can fit physically on the sample tray. We will explain how this can be done in a later step. After having prepared the sample list, use it as a guide to place the patient samples in the corresponding positions on the sample tray. Check the correct tube format is used. Be careful. A mismatch between the assigned tube type in the software and the one used physically can lead to needle crashes. You are now ready to configure the to-do list, also called the work list. The next step during the daily routine consists of programming which tests should be executed for which specific patient sample. This can be done in the Work List menu. In this menu, click on the right side on the Test tab. The sample list shows the ID, the position on the sample tray, and reference of the patient samples previously configured in the Samples menu. Select one patient from the list by clicking once on the line. If more patient samples require the same tests, click once and drag up or down to select more patient samples at once. Then, below, select which method or predefined method profile will be executed for the patient samples. The measurement requests appear in the work list and can be recognized by the letter N, meaning normal patient sample, or U, meaning urgent sample, in the Type column. Continue this way to add all analysis requests for these patient samples. The next step is to assess if the system will be able to process all measurement requests without interruption. Before starting the analysis, verify if the calibrations are valid, if the required reagent bottles are on board, and if the reagent volumes are sufficient to perform the programmed sample tests. This is automatically monitored and displayed in the Monitor menu. In this menu, you will find the following information for all programmed analyses in the work list. The number of tests which can be performed with each reagent. If a button with bottle missing appears, it means there is a measurement programmed in the work list, but the required reagent bottle has not been placed on the reagent tray. Pushing the button will lead you directly to the reagent menu to add the concerned reagent bottle. Add it in the software and also physically on the plate. Press the volume check button to make the analyzer verify the amount of reagent available. Afterwards, go back to the Monitor menu. The bottle missing button has disappeared and the number of tests available with this amount of volume has appeared. The Programmed Test column indicates how many tests are programmed in the work list, but which are still indicated as not scheduled. The next column indicates the number of tests which have already been scheduled in the work list. If the number of programmed or scheduled tests is higher than the number of available tests, this number will be displayed in red. In this case, we recommend filling the specific reagent bottle with more reagent or adding a second reagent bottle now to avoid the analyzer from suspending tests because the reagent bottle is empty during analysis. To refill the concerned reagent bottle, go back to the Reagents menu and locate the specific position of the bottle. Click once on the refill bottle and press the Check Volume button. The analyzer will now verify the volume in the reagent bottle. After refilling the bottle and having checked the available volume, the Monitor menu will display the corrected number of available tests which can be performed with this reagent volume. The blank and the calibration columns indicate if the reagent blank and the calibration are still valid for each method. If the button is green or yellow, you are good to go. If one of these buttons is indicated in red, the reagent blank and the calibration are no longer valid, and we invite you to program and measure these analyses now. To do so, watch our videos regarding the programming of the calibration and the quality controls. The calibrators and the quality control columns indicate if the calibrator or the quality control tubes are available on the sample plate. These buttons should only be indicated in green at the start of the working day, when it is recommended to measure the calibration and the quality controls. It is at this time point that the tubes of the calibrator and the quality controls should be available on the sample plate. To measure patient samples, it is sufficient if all other lines and columns are indicated in green without error messages. Then you can start the sample measurements in the worklist menu. To start the measurements, select the tests for analysis. Then press the Action button and select Execute Test. The test status will change from Not Scheduled to Scheduled. Press Start in the Analyzer status bar to launch the measurements. The analyzer status indicates the time remaining to finish these scheduled measurements. The test status changes to executing once the sample has been pipetted. While the analyzer is still running, it is possible to already prepare the next samples to be analyzed. To do so, go to the Samples menu. Here, continue adding samples to the current sample list. It will not be possible to assign a position at this time point, as all positions from 1 to 10 are already in use. After all tests for the first 10 samples have been completed, you can reassign the positions in the sample list as follows. Press the pause button in the status bar. Then select a sample for which all analyses have been executed. Remove the assigned position number and press Apply. The assigned position has now been deleted. You can now select a new sample and insert the position number you just cleared. Press Apply again and continue as such for the remaining samples if you only have a few samples to add to the list. Otherwise, it is more efficient to assign a position to a large number of samples this way. Press the Sample Plate button. Then remove all samples from the current sample plate in the software by pressing Remove All. Then select one of the new samples and click on the position in the schematic overview of choice. Do so for all new samples. If you return to the sample list, you will see that the assigned positions have been removed for the first 10 samples, and the new samples have a position assigned. After these steps in the software, also physically replace the samples on the sample tray. You can now go to the work list menu and create the new to-do list and execute these tests. A summary of the results is directly displayed in the work list. You see the measured absorbances and the calculated analyte concentration. In the evaluation column, the concentration result is shown on a line diagram in relation to the normal reference range. Concentration values outside the reference range are indicated in blue or in red, and they are flagged with a low or a high letter. Results indicated in black or in gray are in the normal reference range. If the measurements are performed with a valid reagent blank, calibration and quality controls, you can be assured of reliable clinical results. Depending on the requests of users, several types of reports can be created. To print the complete list of tests performed today, press the Print button. Choose if the complete work list or only a small number of selected tests will be printed. A new window is opened to show the work list report. Press the Print button to print this report using the printer connected to the CYANElite computer, or save the report in Excel, PDF or Word format in a folder of choice on the computer. To print a report containing only tests for one specific patient, navigate to the Database menu and press Patient Manager. A new window opens. Find the patient for which the test report should be made and press Show Tests. You can now select which tests should be included in the report by filtering the available results. Choose to view the results by date or by method. To include all test results of a specific date or method, double-click on the header. The black date or method button will become blue to indicate a selection has been made. To make a patient report of this selection, press Print Selected Tests. The patient report is shown. The name and the family name of the patient can be found, in addition to the selected sample results. You can add a comment and sign the report. If only certain tests should be included in the patient report, press the plus sign in front of the date or method to view the tests performed. double-click to select only some test results. In this case, the GOT test performed on the 5th of January. Let's also include the albumin result. To make a patient report of this selection, press Print Selected Tests. You will now see the selected GOT and albumin tests.